So next we're going to talk about membranes, and membranes are these thin protective layers of tissue that end up linking together over top of organs or around the inside of body cavities. They have connective tissue on the inside of them, and on the outside of them they have epithelial cells. The reason they have this is connective tissue wants to stick together, but the epithelial cells actually keeps them from doing that. And most of the ones we see that we're going to talk about will be on the inside. However, sometimes like mucous membranes or cutaneous membranes are actually on the outside of the body. So mucous membranes are going to be lining the inside of the organs like the intestinal tract, the inside of the mouth, the inside of the lungs. And their main job is to keep those areas of the body moist and to actually provide a barrier against bacteria. And so they can be made up of stratified squamous epithelium like in the inside of your mouth. Or you can have like simple columnar epithelium on the inside of your intestinal tract on its lining right there. Underneath the mucosa is what we call submucosa, and submucosa is just connective tissue holding the mucous membrane or the mucosa on, keeping those epithelial cells from going away. They produce a large quantity of mucus, which keeps everything moist, but at the same time, mucus is also a protective barrier against infection and to protect the body against things that would be harmful from the outside. And they also protect, like in the stomach, in the intestinal tract, mucus actually plays a protective role against digestive enzymes and stomach acid and all that. And when we look at mucus, mucus is made up of mucin, which is a protein, and then water and electrolytes that actually mix together. Mucosae or mucous membranes have the ability to absorb, so like the mucous membranes throughout your lungs actually absorb oxygen and help to get rid of carbon dioxide, so they can actually excrete also. Same thing happens in your digestive tract. All of your food that you eat is actually absorbed across mucous membranes in your small intestine and your large intestine. Serous membranes, so we call this serosae, these end up covering around organs, so things like your intestines, your lungs, your heart are actually surrounded with these, and then these serosae actually go around on the inside of the body and actually line the inside of the abdomen, which would be peritoneum, and the inside of the chest, which is pleura. When we look at it, we have parietal layers, which actually lie against the body wall, and then the visceral layers that are actually on top of the organs. When we look in like the abdomen, we have these big sheets of this serosal or serous membrane system in there, and we end up calling these mesenteries. And so the mesenteries not only surround the intestines and the stomach and even the liver, but they also kind of help to suspend and hold those in place. And a lot of times we can actually find blood vessels that run through this mesentery, and also we can have different ligaments that we'll call broad ligaments that actually help to keep certain organs in place. So it's just a simple layer of squamous epithelium. There's a little bit of mucus, but not much in there. Mostly what they produce is a little bit of a transidate, a little bit of a liquid, which helps to keep them slick, to keep them from sticking to each other, and to keep the epithelium from actually getting damaged. If we find it in the chest, we call it pleural fluid, going with the pleura. If it's in the abdomen, it's peritoneal fluid. The heart actually has this serous membrane around it that we call the pericardium. It actually arises from the pleura, but since it's on the heart, we call it the pericardium. And in it, there's a small amount of fluid in there called pericardial fluid. And so this fluid is normally found. Once again, it keeps everything slick. If you don't have it, then that epithelium becomes damaged, and when it becomes damaged, it exposes connective tissue underneath, and then you get collagen and fibrin tags produced, and we get things like adhesions, where organs actually start to stick to each other, and it makes an extremely painful condition. So this fluid is normally there to keep that from happening. Sometimes we actually get excessive amount of fluid built up, and so we can see this in the case of too much fluid in the abdomen as ascites, or around the kidneys as nephrosis, or we can also get peritonitis, where it's from inflammation in the abdomen that causes that excess fluid being made. We can also get around the chest, and we'll see that with pleuritis or pleurisy, or around the heart called pericarditis. Once again, if we don't have enough fluid, then we actually get adhesions, and that's an extremely painful condition to have happen. Cutaneous membranes, well, this is going to be your skin, and so this is going to be made up of keratinized, stratified squamous epithelium. A lot of times it's like 18 layers plus thick, plus the hair and everything there, and so the outer layer where all of these epithelial cells are the epidermis, and then the mucosa, kind of, or what would be comparable to submucosa, is actually the dermis, so the connective tissue underneath. So both of them actually have connective tissue underneath. It's just in the skin we call it dermis, and in the mucous membranes we call it submucosa. Lastly, we have synovial membranes, and so these are actually formed joint capsules, or what we end up knowing also as synovial capsules. And so these actually go in between the bones where you have a joint, and they actually keep the what should be in that joint space right there, or in the articular area right there, inside of there, and they actually produce the fluid that's in there. So what it's actually trying to keep in is between all of your joints on your long bones and on your appendicular skeleton, we actually have a certain amount of fluid in there that actually keeps the cartilage from touching each other, and actually helps us suspend the bones apart, and allows for the joint to actually have motion without actually damaging any of the bones or the cartilage or anything. And so these synovial membranes actually hold that fluid in. Interesting thing about these is, all the other membranes we talked about actually have epithelium, but synovial membranes do not. And their big job is producing that joint fluid, and the main thing in it is actually more of those polysulfated glycosaminoglycans that we talked about in the ground matrix of cartilage and stuff. They actually make some in a form called hyaluronic acid that actually is what's in the normal joint fluid. It makes it really thick and viscous to where it can actually sit there and cushion and support the cartilage and keep it from hitting anything or being damaged.